tips on VTE prevention and management for nursing. Prevention. All hospitalized patients have at least one risk factor for VTE. Early mobility is the single most effective intervention we can do to help prevent our patients from developing VTEs. Patient education includes sequential compression device or SCD utilization, mobility, calf flexing, and making sure the patient knows why they may be receiving enoxaparin injections. SCDs and TED hose must be worn consistently and charted consistently. Assessment for signs and symptoms of VTE. DVT. Pain, swelling, discoloration, which is a bluish or reddish color, and warmth of the affected area. This can occur in one or more extremity or in both upper and lower extremities. This may involve the foot, ankle, calf, whole arm, or whole leg. Symptoms range from mild to severe. PE. Sudden shortness of breath, chest pain, may be worse with deep breath, coughing for no reason, the patient may cough up blood, and unexplained tachycardia. Some patients may be asymptomatic. Nursing management of VTE. We must know the signs and symptoms and the risk factors for VTE. We must select the correct nomogram ordered by the licensed independent practitioner and manage the patient accordingly. Patients who develop a VTE are at increased risk for developing another. We must educate the patient and ancillary staff to never massage a suspected VTE. Patient education. We must educate our patients on the signs and symptoms of VTE. We must let them know the importance of getting out of bed and wearing our SCDs and TED hose. Patients are still at risk after discharge, up to 5 weeks. Importance of taking prophylactic and treatment medications as prescribed. And education should be provided and documented in the patient's chart throughout the course of the hospital stay. This is on admission, during the stay, and at discharge.
Surgical Care Improvement Project, SCIP VTE Core Measures. SCIP VTE prophylaxis includes both chemical and mechanical interventions. SCIP VTE prophylaxis is time sensitive. It must be provided anywhere from 24 hours prior to anesthesia start time through 24 hours post-anesthesia end time. If heparin or enoxaparin is ordered, please administer and document as soon as possible. If a patient refuses VTE prophylaxis treatment, it must be documented in the patient record within the specified time frame.
VTE core measures. VTE core measures apply to all the inpatient population age 18 and older. If TED hose or SCDs are ordered, document them as on the patient or patient refusal. If a patient is discharged on warfarin, document that the warfarin discharge education information has been given to the patient or caregiver. For more information, here are some additional resources at UNC hospitals.